Thank you. Hey sister. Hello. So these are the cases that we have for today. First is the mid-mental embolization, which is over. Now we are starting with tier 1, that is transarterial radioembolization tier 1. One patient, two patients for tier 1. Then we have thyroid cyst ablation. This is tier 1 getting started. So first patient for tier is going on. So this is the liver of the patient. This patient has a tumor in the liver. Okay. Now we are trying to send radioembolization drug into the tumor selectively. Okay. This is our goal. This we will do in TARE part 2. In TARE part 1, we are checking two things. One thing is seeing the blood supply of this tumor, from which all arteries this tumor is getting blood. Okay. Other thing is we want to see, if we do the radioembolization to this tumor, how much amount of the radioembolization drug will go into lungs. So in TARE part 1, we check two things: the blood supply of the tumor and how much radioembolization will go into the lungs. Because this drug, if it goes into lungs too much, it causes respiratory fibrosis, which might lead to lung problem later on. So this is what we are going to do right now. We have two patients. One thing that happens a lot in Delhi is liver abscess. ये patient को देखिए, very young, 25 years का male patient. He has such a big liver abscess. ये देखो, all the black thing is the liver abscess. So now I am going there to put a drain in this pus filled cavity so that all the pus comes out and he feels better, and his infection should also subside gradually. Patient also has fluid in cyst. So अगर तुम ना बाहर का खाना ज़्यादा खा रहे हो तो ये तुम्हें भी होने का चांस बहुत ज़्यादा है. So let's talk about liver cancer today and the various treatment options available. So, ठीक है ना? So in liver cancer treatment, there are two things you have to treat. One is the tumor. Other thing is, most of these patients have a liver failure, that is liver cirrhosis. So you have to take care of both the things. Now the treatment depends on if the patient has cirrhosis or only tumor. Based on this, we will divide the patient. This is a patient with liver tumor plus normal liver. Whereas this is a patient who has liver tumor plus liver cirrhosis. Okay, now the various treatment options are: from IR side, there is embolization of tumor. That is either TARE, that is transarterial radioembolization, or TACE. And if the tumor fulfills the criteria and small in size and small and less in number, then there is treatment option called ablation, where we burn the tumor. There are two ablations: radiofrequency ablation and microwave ablation. Okay, these are the predominant IR treatments. Whereas when it comes to surgery, if the patient's liver is fine and the patient does not have cirrhosis, then they can cut out the tumor like this. But once the patient has liver cirrhosis, surgery becomes much more difficult, because cirrhotic livers bleed a lot and the patient also has portal hypertension. Therefore, if the liver has cirrhosis, most of the time you cannot do surgery. And the only options left are these. These will help control the local tumor disease. So before the tumor goes down, and now the patient's underlying cirrhosis will be taken care of by doing a transplant. So this in nutshell is the various treatment options for liver tumor. Now let's go. The transarterial radioembolization case is starting. Let's scrub and enter the case.
east or west, Mahesh is the best.
अरे भाई नहीं वीडियो के लिए नहीं यार
फिर
क्या
से-
क्या केसेस किया तुमने आज
फिर से करो.
Tear,
टेयर पार्ट 1 सिस्ट एब्लेशन
and now TJLV.
टीजीएलबी उसके बाद ब्रोंकियल आर्टरी एम्बोलिशन सबसे पहले आज हुआ मिडिल मेंजर आर्टरी एम्बोलिशन 6 केस हुए हैं आज so these are all the cases posted for today done with all the cases